Okay, so what we're going to do is recap on technique for the shoulder using soft tissue release techniques. It's like a modified active release technique. I also call them body massage or body master method sort of technique. So apply a bit of fascial cream around the posterior part of the scapula. So you've got the spine of the scapula, medial border, inferior angle, and auxiliary border here. So you've got the infraspinatus. And what we're going to get a patient to do is, from this position, slowly ask them to reach across the body. And then technique number one is literally you can apply relative light pressure around the infraspinatus and lock in, and then ask your patient to slowly bring the arm forward as far as they comfortably can, and then you can apply pressure as they come through that. There's normally like an active trigger point in here, and then if you wanted to you can release the trigger as well as you go through, so you can lock in and then you can reach through that. Like so. Other techniques you can do with the thumb. So from this position you have almost a few choices here. So when you're ready again, please. So you can literally glide towards the origin from there. And off you go again. And you can also glide towards the insertion. So you can slide through that technique there. But if you want to do a sliding sort of technique, the one I quite like to do is, if I was to use 2 or 3 fingers and then find the acromion process or the corner of it, and then from this angle there. So this would be more of a passive technique because I'm doing the movement for my patient and I'm slowly controlling the speed of the arm as I come through that. Like so. We can also change the angle, so we come down into the teres minor. We can just bring the arm into slight abduction with horizontal flexion, coming through that nice and slow. If you get your patient to do the movement, so if they reach forward, so they're reaching forward, so I'm controlling the weight of the arm, so that's more of an active movement. And as I said, if I do the movement for my patient, then that's going to be more passive. If you get a patient to help you, then you can also go active passive, so my patient is bringing the arm whilst I'm controlling the movement, so that'll be like an active passive technique, coming down through that. And again I can come down, it's a little tender point just on that teres minor coming through, like so. And quite a nice one to do is, if you get a patient to resist, so if you pull forward resisting slightly, but we are allowing the movement, activation of the anterior muscles of the pecs will cause an inhibition of the posterior muscles of the infra and the posterior delt. So by resisting forward, just go forward again. So by resisting, all this becomes relatively relaxed now, and you can work through that. And sometimes it can be a little easier to work through. So that's working through the infraspinatus. The supraspinatus in the supraspinous fossa, what we can do with this one, I tend to, if you ask the patient to hold the arm in this position, obviously the deltoid is contracting and the trapezius, so it's awkward to get into the supraspinous fossa. If they are relatively relaxed, then you can almost use one finger, reinforce onto the opposite finger, and then from this position you can almost like rotate the finger into that fossa, and then what we can do is come into the muscle, and then slowly, if I was to lower the arm down, so as I go through, is that okay? A little tender there? Okay, so as I come through, like so. So I'm actually doing the work, so it'll be a passive release technique because I'm doing the movement for my patient. As I'm coming down through that, so nice and slow, it's a little tender point. If you do find a tender point, there's one just in here, we can just wait and just wait for it just to relax a little bit. Because that trigger could refer into the posterior part of the head, maybe headaches, and even into the arm. So if you can hold that for a few seconds, and then you can carry on through. If you ask a patient to slowly push their arm down, so they're adducting, so push your arm down, so that will actually cause inhibition of the supra. So you might find that actually relaxes the muscle a bit easier. So if they were to resist, like an isotonic as they come down, and then you can come through as they're working down through that arm. Okay? Yeah, so you can come into this position again, and then working through. If you've got any impingement in the shoulder, if someone lifts their arm up like a painful arc, then the supraspinatus, in this position, the muscle tendon junction shows itself within the fossa here, so we can actually get to it, whereas if the arm is down, then obviously the tendon is being stretched towards the insertion on the greater tubular. So with the arm up, we can actually get in, and and then we can work through that. We can also bring it forward slightly, or we can bring it slightly posteriorly, so we can just change angle. Even in a rotation, you'll find external rotation will actually shorten the tissue, whereas internal is actually going to relax it as we come down through that. Okay, so there's techniques we can use to release the supraspinatus and infraspinatus with the teres minor. All okay now? Yeah.